Okay, now let me get your name.
Josh Stearns, S-T-E-A-R-N-S.
And what is your position with the Piedmont Rescue Squad?
I'm a paramedic.
Okay. Tell me how these things work, what they are and how they work.
The Lucas chest compression machine, the idea behind it is that it allows us to deliver CPR, uninterrupted CPR to our patients that are in cardiac arrest, in other words, if their heart's not beating. The advantages of the machine is that it does allow us to abide by the recent American Heart Association guidelines, which say to push hard and fast and not stop under any circumstances. When we do CPR, we're circulating the oxygenated blood through the body, the oxygen that we're providing because they're not breathing either. We're circulating that through their body and getting oxygen to their brain and their vital organs. If we have to stop CPR, such as if we have to load the patient in the ambulance or unload the patient from the ambulance or stop to get a medication or something else, then that oxygen level is diminishing again. And studies have shown that interrupting CPR for just a matter of seconds can cause a dramatic decrease in survivability. In other words, the patient leaving the hospital after cardiac arrest. So this machine allows us to set it, turn it on, make sure that we're providing quality CPR, and concentrate on giving medications and managing their airway and things like that. The machine doesn't get tired. The machine doesn't get off center of the chest. The machine does just what it's supposed to do. It pushes hard and fast.
Now tell me the importance of having something like this in a place like Piedmont, just 30 minutes from hospitals in either Anniston or Kansas.
Absolutely. That's another important thing to remember, is that we typically do have long transport times, especially to higher level care facilities such as Anniston or Gadsden. And it allows us to, again, provide uninterrupted CPR for a long period of time. It also allows us to, if the situation arises, allows us to operate with minimal staffing. You know, we always like to have an extra crew member on hand, but if that's not the case, then I have one here as far as providing CPR goes. It also allows us to It also allows our crews to remain safer during those long transport times, because instead of standing up in the back of the ambulance, it's going to be traveling at a high rate of speed, through traffic and whatnot. It allows us to sit down and be restrained as we're supposed to be while we monitor the airway, administer medications, perform EKGs, things like that, instead of standing up and performing CPR.
How many of these does Piedmont have, and how did Piedmont come about these?
We have 7 of them. We got them from, we bought them with money we received from FEMA Assistance to Firefighters Grant. The amount was about $96,000 total that we received. So we used all that money. We purchased 7 machines, one for each of our ambulances. And we're one of just a few ambulance services in the state that has one on every single ambulance we have. There are there are other devices like this one, and different manufactured by different companies. Most ambulance services have 1 or 2 for their mainline ambulances, but we put one on every ambulance we have. The reason we did that, we thought it was important to do that, is because if all of our ambulances are on calls and someone goes into cardiac arrest, just because they don't get a first-line ambulance doesn't mean they shouldn't get first-line treatment.